Reza, what's your coffee story, or what are you drinking this morning?
I've got I don't know if you can see this. I've got a Star Wars mug, and
Whoa.
I thought, so Monday is May the 4th, and so May the 4th be with you all. And I'm a big Star Wars fan, so somebody gave me this as a gift. I've got all sorts of Star Wars paraphernalia around, so and I'm drinking. That's classified what I'm drinking, but
That's a good answer. That's so I have to ask you your feelings about the Mandalorian. Have you watched all the episodes? Do you like Mandalorian? Is it true to the Star Wars empire?
I enjoyed it. I'm not such a purist that I've disavowed all the new stuff. So actually, my wife, who's not a science fiction fan at all, I
Oh,
have to give her props. I had her sit through The Mandalorian with me over a few weeks, and she actually enjoyed it. So yeah, it was good.
that's
If I can get
awesome.
her on board, that's a good thing. So
That's a good measurement. Well, I mean, the Mandalorian seems more, it's almost like a Western, kind of
yeah.
a set in a science fiction. So that's great. John, what about you? What are you drinking this morning, or your cup, or you got a little story for us?
Yeah, I'm drinking just my Friday latte. Healthcare puts in a lot of long weeks, so look forward to a Friday latte. We usually start early in healthcare, so it's great. Just kind of it's more psychological than anything. So it's a good smooth drink, and we have a nice brewed awakening on site here that we can get those made for us. So it's just maybe a little comfort food on Friday, and it is a pure latte. There's nothing else in there for the record. Thank you.
Oh, that's awesome. Is that from the cafeteria there on your campus?
No, there's one in our care center that has a specific coffee shop that's open to the public. So that's where I got it from.
Oh, that's
Thanks.
perfect. Thank you. And Rob, how about your coffee story or cup, or what do you got?
Well, I just have a little Lourdes tumbler here. It's got just some water in it this morning, but the cup just symbol. I just had my 1 year anniversary, and they kept me around, and the cup's still around. So I guess that's the good news. So
That's great. I think I was doing a little research on all of our bios, and we're all, relative within the last 2 years in our positions that we have. And so I guess as the newest kid on the block, I'm hopeful I'll make that 1 year anniversary like you, Rob.
Yeah, we hope you do too.
Yeah, thanks. It's a vote of confidence from a board member. Thanks. Well, let's just kick it off with kind of a check-in. How we'll go around the virtual room, I guess, and if each of you could just talk a few minutes about how are things going with you and your teams, your staff and your patients. Just a very general, 30,000-foot view. If you could start off, and maybe John, you could start us off.
Right. So it's certainly hospitals have been used to dealing with infectious disease for a long time. So that the concept and using protection equipment or PPE, personal protection equipment, is not new, but just I think the broader sense of this and the media that came with it, it created more of a sense of concerns out there. But certainly we had to adapt some processes that were a little bit different, and we had to be diligent about doing that. And I think there's still, based on, again, I'm not blaming the media, but a lot of it is just a fear factor. And the toughest part is not having visitors able to meet with their loved ones. That stuff breaks my heart. Although we've used alternative means of communication and those things, it's just tough in certain circumstances to be technically, really alone, even though caregivers are there and we try to, chaplain and all those kind of things to review. So I think overall we're doing well. In general, we had a drop off, and then it's kind of come back a little bit, but the numbers are manageable for sure in our ICU and others. So we remain prepared, whatever comes our way, and hopefully that stuff will continue to drop off. So in general, I think we're in good shape today. Thank you.
That sounds great. And I'll just take a minute. I forgot to remind our audience, if you do have a question for our panel, if you're on Zoom, we have the question and answer feature at the bottom. If you click on that and type in your question, then we'll go through those and try to get to your questions. On Facebook Live, I believe that you post in the comment section, and then we'll get a chance to get into those questions. So if anybody have a question as we go through this, we would really like people to log in. Reza, do you want to go next and kind of tell us how it's going at Kadlec?
Sure. It's amazing in times like these, I think, just to see how people rally to make the best of a tough situation. And I want to thank you, Karl, and Tridec. At the beginning of this, I reached out, and you kind of sprung into action with getting some asks to the business community for help with PPE and some of that. I think in the 2 days where Tridec was running it, I heard a number like 26,000 PPE items that were brought forward, and that's transitioned now to the emergency preparedness folks who've been managing that. But thanks to you and Tracy and others that were involved with that, and all the community support too. I think it's been really heartening for our staff, seeing everything from the prayers, the donations, the thank you notes, the chalk art in some cases on the sidewalks outside the facilities. Just an amazing outpouring of support from the community for healthcare workers. I think for all the health systems here. Generally, I think people are doing pretty well. It is, as John mentioned, in our normal routine, taking care of these infectious patients and whatnot. But I think that the biggest difference, again, I would echo that, is the lack of ability to have visitors, which creates huge challenges for families, obviously, and then trying to work through those things probably similarly to the others with technology and other approaches that certainly don't make up for that individual contact with loved ones and family members. And then I think our staff, who get the brunt of some of that as people understandably react badly in some of those situations, and it just puts everybody in kind of an awkward situation. That's been probably the hardest thing. And then just the variation in what people are dealing with. So you've got everything from the folks in the ICU that are dealing with what we just talked about, and the effects of, up to and including holding the hands of folks that are passing away and trying to help bridge the communication to folks in other areas that don't have a lot to do right now and are maybe being worked in other areas that they're not used to or comfortable with, and trying to learn new skills quickly. And then some folks that may be low census and at home because of elective types of things that have been closed and that are on hold. So healthcare, I think, deals with it on both sides of the issue. We've got the issue of trying to deal with the healthcare crisis and manage a bit differently in that respect, but then we're just like every other business in another respect, in that, as we turn this dial with the community opening and what that looks like going forward, we have the same issues that others have in terms of our business being impacted on a lot of other fronts. So it's an interesting time. And the biggest thing for me is just how amazing our caregivers in the community have been so far through this. So.
Oh, that's great. Thanks, Reza. And Rob, how you guys doing at Lourdes?
Yeah, well, I would agree with what both Reza and John have said, but for us, I've just been amazed at how everyone has just come to the table across the board, community members, but more than anything, our staff here at the hospital, our medical staff, our nursing staff, everybody here. Each department here has been affected, as my other two panelists have said, but it's just been great to see with all these curveballs that everybody here has really stepped up to the plate to really figure out the game plan on how can we best care for our patients, but also care for the community, care for each other. And, I think everyone here is obviously ready to get back to whatever the new normal is going to be after this event. And we're looking forward to that and daily working on kind of what that looks like. We have patients that are ready to have procedures done. We have providers who are ready to do that. And we just are going to continue working our plan and making sure we can do that safely and for everybody involved. And appreciate all the community support that has been shown throughout this whole event for all three of the hospitals, and the community has just been overwhelming.
You bet. That sounds good. How about reason that, thanks for the shout out. When we first started this, the PPE drive that we put together for all the healthcare providers, and then we're able to coordinate it through the emergency management. And then I think that PPE that was collected was dispersed to everyone. And with our last check-in, the emergency management folks said that there was a greater demand for PPE, like at the smaller providers, even, nursing homes and some of the first responders. I know we were with Pasco Fire Department, and they had approval from maybe Department of Health to actually bake their N95 masks in the oven at 200 degrees for like 8 hours or something and reuse it. So how about PPE? I know that was maybe an initial concern up front, but how are each of you doing on the personal protective equipment supplies, and then testing? If you could talk about how, where are you on access to tests, for people that might feel sick, or even then as we do look forward to reopening, where are each of you and your teams on having a testing protocol, or, we've heard of drive-through testing in other communities and stuff. So Rob, you were last time, so you want to go first this time with that one?
Sure. Well, from a PPE standpoint, our materials management group has been working extremely hard in making sure that we're, staying up on our levels of PPE, and they've obviously beat a lot of bushes, and the community donations and the things have obviously helped with that. But on most PPE items, we're looking at about 30 days, right now, according to our current burn rate, which is a pretty solid place to be. And as I said, the team is working extremely hard to keep those coming in. As far as testing, it's about the same for testing. Over the last 6 or 8 weeks, we've been testing around 8 individuals a day, and so our kits are holding out okay, and we continue to get stock of those in as well to meet the kind of return to elective procedure, as well as we'll be testing those individuals that are coming in for elective type cases. So for the most part, like I said, it's a day by day, and some it just depends on kind of what patients you have in house. We'll may burn through some more PPE in a certain area, but we're doing everything we can to replenish as soon as we can. So
you bet. Reza, how about Kadlec? How are you guys doing on PPE and testing supplies and equipment?
The situation has improved. I would say, a lot of the, similar to Rob's comments, a lot of our materials management team's hard work, and the Providence system, some of their efforts at sourcing, whether it's scouring the globe, looking at resources through the supply chain, or looking at some of these domestic manufacturing opportunities and things. There's been an increase in some of that. And the other side is we've been utilizing less of it, obviously, with the elective surgeries having been postponed, and trying to be more mindful maybe in the past. And it's interesting how things that become short in supply become more valuable very quickly, supply and demand. So the cost of getting those has not been small, but that's improved quite a bit. I think the next thing will be, and I think we're going to talk a little bit later about the getting back to business, but looking at those supplies and making sure we have processes in place. You mentioned the thing with some of the masks. So the N95 masks, there's a process through Battelle that has been set up where they're using hydrogen peroxide to sterilize the masks, and we're going to be participating in that. And it's a safe and proven methodology. So with N95s, at least, that's an opportunity for us to do a little bit of safe reuse. On the testing front, I think we're doing again a lot better. I heard this morning we've got some of these point of care rapid turnaround tests now finally available through Cepheid and Abbott, are the 2 platforms that we have access to. And it's day by day, week by week, looking at supplies, and it is just these swabs and test kits are really on the front end that are the choke point more than the reagent. And you've got these large testing labs, so whether it's LabCorp or UW or others that are able to run a lot of tests, but the limiting factor is often how many of the test kits on the front end do you have. But again, that's improving and starting to see some change there. So I think in better shape than we were, but again, watching that as we start bringing other cases online. We are going to be doing some screening testing as a precaution with surgeries and other things. So making sure we've got enough of those test kits to test our staff, to test cases coming in on a screening basis, as well as obviously folks for specific diagnostic COVID testing will be important. But my suspicion is as the weeks go on and more things are coming online, that situation will start to resolve itself. We're all disappointed that we didn't have access to this much earlier on in the situation, but it's improving week by week.
Okay. John, how are you guys doing?
Yeah, we're similar to Rob. We've got about 3 weeks, 30 days supplies on hand, and certainly Rob and I share a market supply director, and she got ahead of it quite a bit. Believe it or not, she saw something that kind of tweaked her interest early on in January, ordered a bunch of stuff, and so we had a lot available, but it wasn't it because of the volume and the kind of the mini surge right away. It went through quite a bit, and as we got in the rhythm of how we use stuff and how we switch out equipment and people, we kind of watched that. So our supplies are really looking good, and I think We also accessed some of the supplies from the state. We got deliveries from the state emergency, so we really appreciated that. I got a couple pallets. I think Lourdes and Trios did, and I think Kadlec did, and some of the emergency management. So it just took a while to get those machines up and running to kind of roll that out, and then of course the delivery. But once it was there, we got it delivered fairly quickly. So we thank the hospital association and others that advocated for the masks. Actually, the hospital association is buying masks and other PPE on their own to kind of help out hospitals too. And although we haven't had to take advantage of that, again, it just creative times call creative approaches, and they've stepped up to the plate on that, and that is great to see. And then of course we're part of LifePoint, and they monitor, we report that daily. They monitor stuff. And just yesterday there was some supplies moved around for the greatest need in the Western Division, which is what we are. And that's great to see, because if we need something in the future, that's there. So testing is so that's regards to PPE. Testing is same. We have about, I think we have 3 weeks on hand, but it just varies by the number of people we need to test. Unfortunately, we're able to do those tests locally, but we can't get enough kits to do testing. So that's the rate limiting factor. And we hope that supply will free up at some point, because we have the machines to do that. And that's the frustrating part, because our turnaround time now is about 2 days or 2 days or less to get results back. And then people are anxious during that time, and we could have rapid testing. And as we look at, ramping up or what to do with our employees or antibiotic testing, all that kind of goes into that mix. So we're continuing to sort through the testing side, but again, that seems to be the rate limiting factor of just the kits that are needed to do the testing. And there's no silver bullet on that. That has not caught up like the rest of the PPE stuff.
But, well, thanks guys for that one. John, you mentioned the hospital association, and that was a question I was going to ask. I know there was a statement this week that the hospital association asked the governor to potentially open up healthcare providers to do elective surgeries, or probably not even using that term right, but open up for some surgeries. And it kind of relates to one of the questions that we've got in the question and answer that's asking about, people are saying it's not that bad here. And so I'm kind of combining a couple of questions together, but maybe each of you could talk a little bit about how your business has been affected. And so I think we've seen, John, you had a good comment, about sometimes, we hear stuff out there in different capacities from news sources or even social media, which, kind of gets really out there, but people talking about, oh, they're not that busy, there's excess capacity, it's not true. So could each of you maybe talk about the impact of not being able to do the full, healthcare treatments that you could before the shutdown, and how that's affected your business? And then how that affects, like however you measure your capacity, like in beds or, patients or something like that. Am I framing that up? That kind of makes sense? And this time, maybe Reza, you want to kick that one off?
I'm sure I can talk a little bit about that. I'll start with your question about the governor's proclamation and some of the WISHA efforts to get that opened up. I think what he's trying to do, obviously, is time this well, and go back to that metaphor that I've heard him and others use of sort of turning that dial at the right speed. And so we feel with where we are right now in terms of surgical volume, we've got a backlog of about 2,400 surgical cases that we need to move through that have been paused. And people use this term elective surgeries, and I think what that maybe conjures up is things like cosmetic surgeries and things like that. But we're really talking about important surgeries that maybe could wait a little bit longer, that aren't going to have a really deleterious effect on people. But again, that's a bit of a subjective thing, and there are quite a few things that I think are being held at bay right now that are starting to get built up and need to get done. So we're running at about 18% of our surgical capacity right now, just to give you a sense. Our goal is to try to get to about 50% once things get opened up, and we're trying to get some clarity on that, as the others are and the whole state is. And again, it's that balance of, you talk about flattening the curve and the importance of doing that, and not wanting people to get overconfident that we're in good shape. As we look at this day by day, again, we're starting to see numbers tick up in the Tri-Cities. And so we don't want to get farther down that curve and see another spike because people get overconfident. But at the moment, as you said, we're doing pretty well as a community and want to keep that going. The concerns with the Tyson plant and a lot of the long-term care facilities and all that are things we need to be watching carefully, in addition to what the broader community is doing. But we think we're in good shape right now, going back to PPE testing capabilities, as well as needing to get our staff back to work. And I think most importantly, getting this backlog kind of worked down. And it's not just with surgeries. I think the concern is if you've got a population that is putting off care because of either fear of coming into a hospital or a healthcare environment because they're going to be exposed to COVID, we've got to reassure them that we've got things in place to keep them protected. You're going to have now further, worsening of conditions and sicker patients coming into the health system as time goes on. So we talk about these waves and spikes. We're anticipating down the line another wave and a spike potentially of non-COVID exacerbation of issues if we don't start working these queues and getting people back taking care of their health care. So that's pretty big. I'll give you a sense. You asked about some capacity numbers. So on the hospital side, as an example, today we've got 194 inpatients in the hospital at Kadlec. We can take up to 300 for what we're staffed for and able to do today. So we're running about 65% capacity and have ability to take more. In the ICU, I know there's been a lot of concerns nationally about are there enough ventilators and situations in places like New York. We're good on ventilators. We're seeing typically in the single digits of COVID patients on vents in the hospital at any given time. So, and roughly 10% maybe of that total census I mentioned, give or take, of COVID positive patients. And you can see the community numbers if you look on the Benton Franklin website of the total hospitalized patients and the total in the ICU and so forth. So does that answer? That's kind of a sense of where we are.
Yeah, no, that's great. I kind of combined like 3 or 4 questions together, so I appreciate you hitting all of them. Rob, how are you guys doing on kind of, the same topic there?
Yeah, I would say it's very similar. We're running at half of our capacity in a lot of our areas. One of the largest areas here, obviously, for Lourdes has been our surgical volumes, which took a tremendous hit. And for us, it's, again, playing all those factors in, the prevalence of COVID, availability of PPE, testing ability, balancing all that as we move back and to be able to do it safely and assure that we have capacity to take, as Reza said, we expect to see spikes, not even COVID related, but for other other issues when people come out of the once the COVID veil is lifted, I guess, we're going to experience these spikes. And frankly, as we monitor and look, going through the summer into the fall, which is historically all of our busiest times of the year, we may see a wave that lasts from, midsummer through the fall. And how are we ready to take that on as a community and as frankly as the 3 facilities and work through that. So I think it'll be just continuous planning and working with when Governor Inslee's executive order is lifted and or the new path is rolled out. How can we effectively move forward and do that as efficiently as possible so that we can get our staff back in full time, our patients back in full time, and frankly get things kind of just back on track.
You bet. John, how about Treehouse?
Yeah, very similar, just a couple of different nuances. And, our volume certainly is down. Our ER volume is down about 30 or 40%. Surgical is way down for obvious reasons, but our inpatient unit is pretty steady because of, treating rule out COVID or regular patients. And so that's been kind of steady, but we certainly have a lot more capacity in our ICU and hospital to increase if need be, or the volume gets up there. One of the things, talking feedback from our surgeons, is that this urgent, non-emergent surgeries is at some point those electives turned into urgent because they're at a tipping point of pain and other things. And so, our physicians are really at the cusp now of we got to start doing more surgeries. They've turned in from elective to urgent. And I think that at some point there's a cost benefit to the patient that just said, I tried to endure this and I can't do it. Talking to our ER physicians, he said that, most of them are saying that a lot of people are just really staying away, but then by staying away and staying in the home. Elderly, they come in, they're very weak, they're compromised, or perhaps if they felt more comfortable, they could come in earlier and be treated a lot differently. And so we're starting to see some consequences for a good intention process that I think needed to be done, but there are some unintended consequences, and that's one of them. So I think we're excited to get things geared up as long as we can do it safely and proactively. But I think right now the elective cases are off till May 18th. The governor may say something today. We hope and anticipate there's been some clarification to his order. So there's some variety of things that we can do, and certainly we're monitoring that. But again, it's just that tipping point for the patients that shouldn't have to endure staying at home in pain when there's certainly a safe solution for them to come in and get that done, and not stay overnight at the hospital and take up capacity, but really just treat them. So I think that's the frustration part of it with the physicians. They get the broader level, but it's all about patient advocacy for them and certainly for us. And so we'll continue to monitor that.
That sounds good. And just a real quick clarification, we had a question about, Reza, you had talked about the numbers are going up here just in the last couple of days. And I think I can just cover that one for us, because you did say that according to Benton Franklin Health District, and that's where I know we get our numbers, we kind of do a daily check-in with that and send out some clips to the team. The question was that, CDC says the numbers for the state are going down. They don't track our local numbers, but you did reference and said the numbers that are going up here in the last few days are according to the Benton Franklin Health District.
Yes, that's correct.
Okay. There is a question from the audience that we had about, if you could go back 2 years in time and you knew this was coming, what changes would each of you make? And, that might apply to, workforce or equipment or supplies or ordering. And maybe John, you want to kick us off on that one?
Well, certainly after this is done, there's going to be a lot of, review of our processes and debriefings and kind of best practices. Certainly, although we're required to have emergency plans, and again, we're used to dealing with infection control. I think there's really hospitals haven't had to worry about thinking about if there was we've done some surge planning, but not as intense. I think from my perspective, I've been at this 36 years, never been this intense about what potentially we could surge a hospital to be and actually have to think about it. We've done some exercises and those kind of process, but the reality of it brought it home closer, I think, than it ever has. So really more surge planning. There's some really smart people on my team, and I'm sure at all the other places that thought creatively of how we could deal with that to serve the public. And then, I think the other one, it's outside of our industry, but really, it really points out the capacity of our nursing homes in the area and where they're at and their PPE and their preparation. Certainly, they haven't seen anything like this. And going back, I'm not sure they're highly regulated as it is. So I think that's something to think about as a community. And then really looking at an alternative care site, which finally we're looking at is people that can't go back to nursing homes to find those facilities. And although all three hospitals brainstormed that early on, certainly to kind of think that through a little bit more. So I think there's elements that, we could have been prepared for. There's elements that we're going to do a lot better in the future and have that scenario down. So
that sounds good. Reza, you want to hit that one next?
Gosh, that's a real provocative question. I think depending how far upstream you want to go with that, there's what the hospitals do, but I heard an ICU doctor really recently say that we keep getting referred to as the front line, and really we are the last line of defense if you look at the way this sort of thing progresses. And so my thought would be, how do we, with our funding for our health departments and health districts, how do we, with the ability to have testing available through them and contact tracing, and for the next epidemic that comes like this, I think there's a lot of lessons learned nationally about how we let our national stockpile of PPE get to where it has been, how we've prepared as a country and as a global society for this sort of thing. So if you want to go in that direction, I think if we had 2 years to go back, I would be trying as a hospital leader to lobby the heck out of government and others to help us prepare to not have our last line of defense be so overwhelmed in some places as they have been by this. Because again, I really agree with that doctor's comment about the idea that, we're the front line versus this is the last line of defense. So that's the first thing. In terms of what hospitals could do specifically, similar to John's comments, I think in terms of our emergency preparedness and planning, having those spaces identified for a surge when that last line does become necessary earlier on. And we were able to figure that out pretty quickly here, but and thank God our community was able to get going with the social distancing and some other things, but we could easily have been in the same situation as some other areas, I think. And then again, with the supply chain stuff, just really making sure as a hospital that we are looking at not just day to day. As we look at inventories, our whole mindset has sort of changed in how we're managing things. We've been very much just-in-time inventory for a lot of things for cost reasons and efficiency reasons. But when you start thinking about what could happen, there are some things that just-in-time inventory probably needs to be rethought about. So I think that becomes important as well.
That's a great point. I think it's a great topic too. I think the whole, nation, but probably especially in healthcare and some associated industries, is going to start having this discussion about how are we organized from, and what are the interrelationships of government agencies, from the federal to the state to the local health district, and then the connection to not just hospitals, to your point, but then John's point about nursing homes as well. And that's something that it's one of those things you don't ever think about or talk about until you get into a crisis like this. And now, obviously, as we come out of this, the microscope and internally and externally is going to be in a lot of those systems and kind of a system analysis. I think that's a great point. Rob, do you have any thoughts on this question or this topic?
I agree with both Reza and John and what they've said. I think there's going to be a lot of lessons learned in looking back. If we go back 2 years ago, what could we have done different? I think all the categories that have already been hit is exactly right. Looking back, I've even said with our response, we'll probably 6 months from now look back and we probably could have done something different. But I think that's part of this as we move forward, is just learn from those experiences that we've had. There's nobody working today who's experienced something quite like this. I have another CEO colleague of mine, and he kind of jokingly told me, man, I would take a tornado any day because there's end to that. And I think that's what's driven some of the fear, is just seeing the end. When is the end? When are we going to see the change? And so when you start talking about disaster preparedness, disaster management, that's something that in a lot of our disaster planning, we always saw the end in. And I think that's what we have to, fold that into our conversation moving forward, is, the sustainability over time. These aren't, just 1 week, 2 week, 1 month events. We got to look at more long term, I think, when we talk about disaster management or preparedness.
Yeah, no, that's a great point. I was going to add too that I think that, not just the healthcare industry, but Reza, your point about the supply chain, and obviously supply chain management is a very hot topic, has been for, even the last 20 years or so. And, but not just in the healthcare industries. I think many industries are seeing that the just in time, which from an efficiency point of view, and as logistics are improved and get better and you have access to that supply, it's a great system. But when you get into a crisis like this, it quickly, the wheels literally fall off the bus. And so I think there's going to be a lot of systems analysis, not just in healthcare, but across, the nation, really, especially like globalization and stuff. I know from Tridec, we're having some discussions about how could we possibly attract or build capacity here for, some of the things that are really lacking in the crisis. And that, that might be PPE. If we could find, say, companies that might manufacture certain PPE equipment that even had a crossover into some of the cleanup activities that, go on locally, that would be great for us. But it's, again, these discussions that we're having here today about healthcare, but then there's this broader picture that we're all kind of considering and getting into. It's going to be really interesting to see the way things sort out on that whole supply chain and that side of it. We've had a number of, go ahead.
I was just going to say that the hot topics, obviously, for this particular crisis have been PPE testing, ventilators, ICU beds, some of those things, and who knows what the items will be for the next thing that happens. But that ability to flex quickly in a surge situation, I think becomes really important, and a good lesson from all of this is how do we, for years now in the hospital industry, we've been getting, a lot of stuff preached to us and talking about how the country is overbedded. We have too many hospital beds and we're moving to ambulatory and all this is going to shift. And that's all true. But when you suddenly have a situation like this and you have a community where the number of hospital beds has been decreased to match just that constant sort of level of demand, and you have a surge, what do you do? How do you mobilize to get what you need in place? And I think a lot of that hasn't necessarily been thought through, as all this discussion about reducing hospital beds has been going on for years.
That's a really good point. Maybe we could talk about testing a little bit and then start to transfer into, what we're all working on for reopening as we go up. There's been a number of questions about tests, and I might just say, because we had a conversation the other day with the health district, and I know they're looking for capacity and help both on access to testing equipment and then the contact tracing, which they need to increase capacity. And there's been articles lately about other rural counties, especially that contact tracing, once someone is diagnosed with COVID-19, then they are just manually doing it, calling people up from their contact list and stuff. And so that's been a limiting factor. But maybe let's move into, we've had questions about antibody tests versus like COVID tests. And so are any of you doing any antibody tests? And if anybody could talk about, give a little bit of clarification as possible on antibody testing versus, actual active virus testing. And Rob, you want to kick this one off?
Yeah, so we work with LabCorp, and actually just this week, antibody testing just became available for us to start offering through our clinics, and so I don't have a whole lot to discuss there, other than we'll obviously be seeing kind of where things go with that. As far as the other testing kits that we mentioned earlier, we have a couple different medias that we can use, and we're starting to see a little more access to those. As you said, on the front end, it's the swabs may be in high demand and are a little harder to get at some point. But for our volume and for our demand, we've been okay from the beginning on the actual testing kit piece. It's gotten tight a few times, but we seem to get our supply in kind of just in time, like we were talking earlier. But as far as the antibody testing goes, that's something that we're just kind of getting started with here at Lourdes.
Sounds good. John,
Yeah,
yeah.
Very similar to Rob, certainly same system. We have access to the same lab. So we're doing it. I think that the broader question is how all that rolls out, and is it spot testing by certain businesses? Certainly doing the test to everybody that comes back to work, I think, is problematic. And not that it's not the right thing to do. I just physically, you can't process all those people. So there's a start with that, and that's good news. But I think we're still learning what all that means for the antibiotic testing versus just the COVID test. So a lot to be learned nationally of how that should be rolled out. A lot is discussed as a panacea, but and it may be true, may not be true, but the logistics of pulling that off is another thing.
You bet. Reza?
Yeah, for the COVID testing, I guess in terms of the the swab testing and so forth, we've got a couple of routes. One is sending them out of state for a turnaround that's taking anywhere from a couple of days to 3 or 4 days, which obviously isn't all that helpful when you've got people in-house in the hospital that are trying to move through. And then, as we mentioned earlier, we've got access now to this more real-time point of care testing, which is going to be useful using a different technology though. So it's the accuracy of these tests, I guess, is not perfect. And so you could have a test, the likelihood of getting a false negative back is higher than the likelihood of getting a false positive. So when somebody tests negative currently, if the doctor suspects that this probably is COVID that we're seeing. It's just this, negative test. Sometimes there's a second test that gets done, and we're still waiting on a more conclusive answer. On the serology front, real similar to, or the antibody front, serology testing, real similar to the answers from Rob and John. Providence and Portland is doing a research study where they're testing large numbers of the staff there for antibodies, and that seems to be going well. And there's some discussion about maybe extending that further, but we're not doing any currently. I know there's lots of discussion going on though of how useful that might be going forward with populations, looking at who has developed antibodies for this and might be immune, and all sorts of useful applications potentially for antibody testing. So I think more to come nationally and with all our organizations on that.
You bet. And Reza, we've got you up. I think there's a recent article about a treatment that, as far as I know, Kadlec is doing it, and I'm not sure if there's other access to the treatment, but on an antiviral drug. Can you talk a little bit about that, or?
Yeah, so I don't know if I'd classify it as a treatment. We're part of a research study on an antiviral drug called remdesivir. So it's one of the two that had been flouted for the last number of weeks globally and nationally. And it sounds like from the news yesterday, the broader study is starting to reveal some positive signs. So the FDA may, I think, go with a sort of emergent treatment use of it, which is different than full-on FDA approval. But we're currently just part of that broader research study. And so we are doing that here, but there's really not a lot more conclusively that anybody can say at this point.
Sounds good. How about just one more quick follow-up question for everybody? Workforce. I know, our involvement with Tridec, workforce coming into this, I think across the board, but in healthcare, there were some shortages that aren't just here locally, but nationwide. Access to specific skills and certifications in healthcare, but maybe you could talk a little bit about how you're doing with your workforce. I know we started off and you guys all gave great props to the commitment of your teams and how things are going, but as hopefully the governor is going to open up more access to healthcare, and that maybe each of you can talk a little bit about how you're doing with workforce, and what do you see coming up in the future? Do you see similar demands for those skilled positions? Is there still going to be some shortages? And how are you doing here lately? And John, you want to kick this one off?
Yeah, certainly it's been extremely tough on our employees. We haven't furloughed anybody. We've just low census them, but even so that they're able to take PTO, but that's still problematic for a lot of people. And the question is how long is it, if it continues, if we can continue to do that way. But everyone is precious, and we've worked hard to recruit them. And as our economy grows, we're always needing more and more skilled people. And as Trios looks at it's our mix, we're changing our mix to get more specialized here. And so that creates some gaps that we need to work through. And we're doing really good on meeting that need and recruiting people, because again, Tri-Cities recruits for itself pretty easy in the area. And so we're thankful for that. I've been in other communities that it hasn't been as easy. So this is really very thankful for that. So it's just constantly we think about it. And the other thing is growing our own. We've got a lot of processes in place for kind of working through. We have lots of students. We have a family practice residency program, internal medicine residency program. So growing our own physicians and kind of keep them in the community. And certainly, we're blessed with our end schools here and working through that. There's never enough as the community grows. When you're static, I think that's easier. But as each of the hospitals are growing, it's a constant need. So it still be a factor here. The nice part about here, there's alternative spouse employment. And so it isn't just people are comfortable moving for the two people that work and lifestyle and all that. So it is, whether it's COVID or whether it's something else, recruitment and retention of employees in this day and age is really number one. And it'll continue to be a focus long afterwards.
Great. Rob, how are you guys doing with workforce, and what do you see coming out of this?
Yeah, so I agree with John. I think, in looking at it from two different lenses, I guess it's the short term and then kind of additional long term. Short term game is, as Reza said earlier, we're all coming out of this with a backlog of cases and things that are going to need to get done. And so we'll all be ramping up and looking at, adding additional staff to meet that demand. And so we'll be recruiting, and getting our existing staff back to work. As John said, that's, it's had a substantial impact on a number of our employees with having to take low census and during this time. And we want to get them back just as soon as we can and get things rolling. But the long-term play is as John said, it's the day-to-day grind of healthcare just in general, and always trying to retain your current staff, recruit new staff, medical staff. Changing the dynamic or changing the kind of your menu of options that we are able to offer. It's a continual challenge, but as John said as well, we do have some great local resources, not just here in the Tri-Cities, but even in the state. And it's just something that we'll have to continually work on for forever.
Yeah, you bet. Reza, you want to weigh in on this one?
Yeah, that's a tough one. There's a lot, I guess, to consider, and I don't know with you guys how many of you have young kids, but we've got a kindergartner at home, and so I've had Frozen 2 playing in the background for the last couple of months, and there's this song in that movie called Into the Unknown that I have sort of on repeat in my brain, and that's kind of where I think we are. Some of the additional comments I'll make in addition to what you just heard from Rob and John, which is a similar situation for us, is we don't know what's going to happen with this shift to virtual care. I think in a lot of ways, we've done in the span of a few weeks what we were projecting was going to take years in terms of transitioning people more to telemedicine and virtual care visits and so forth. So primary care might look a little bit different in terms of how that can be done and what that demand looks like for on the ground providers and others. Other things that we do that could be done maybe in different ways that we're learning about now might look a little bit different. And then as the community evolves, I mean, you provided me, Karl, at a request some information about unemployment projections going into the future. So as we look at unemployment across our community and how that's going to impact insurance and a whole lot of other things, we may see the demand for some things start to shift and change. Again, don't know what that's going to look like. So we've been really fortunate historically here with CBC and WSU and kind of a pipeline for a lot of the staff that we have from nursing to other things being locally sourced, and our turnover is pretty low, and we're lucky that way. But some of the specialty providers that we have and others, again, I always say it feels like we're able to provide big city medicine in a relatively small community here, which is great and a wonderful position to be in. But some of that may start to shift, and as people look at the end of this, I guess I'm going to have to say I don't know, and there's a lot we're working on to try to figure out going forward. But right now, we're just feeling good to have the people that we do have doing all the great work to get us through this.
We're down to about 10 minutes, and I haven't really shifted us into the reopening, but maybe if we could each talk a little bit about, and each of you done a great job on talking about, getting back to more of a normal capacity as far as your services in the hospital. But as we work on reopening like different industries, and obviously we know testing is going to have to be a part of that, so that, if there are some employees that have COVID, how do we do testing and stuff? And so could each of you talk about, are you in any discussions in maybe increasing, and obviously we realize there's a shortage of kits, and that's kind of the, between the swabs and the kits themselves, but are you planning to, or you've been in any conversations about each of your hospitals' role within maybe that kind of increase? Hopefully we'll have more access to the kits and swabs, but, to be like a quick resource, if somebody has a sick employee, and as companies, and we're trying to work with companies to try to come up with good guidelines on what companies, as they look forward to reopening, what they should implement as far as, say, temperature monitoring and, access to testing. But maybe that's a good transition out of our conversation today. If let's see, whose turn is it? Rob, you want to go first on that one and talk about like reopening and your hospital's role within that?
Sure. Well, I think, for us here, as far as the hospital, just, getting back to business, John and I both are part of LifePoint, and we have a lot of resources from LifePoint. And they've been working with us now for several weeks and talking about kind of the back to action plan or back to work plans. And it's a very structured process that obviously keeps patient safety and employee safety at the forefront. As far as being resources for the community, that's what we're here for. I mean, we'll work with whoever we need to work with to try to, get everybody back. And we are having some conversations through our OC health clinics and different folks with some employers about that exact topic. And I think what Reza said is there is a lot of unknown out there. So it's kind of day by day as things come up, and we try to plan the best we can to figure out, first of all, how do we get the hospital back up and operational, and do it in a safe, efficient manner. But also how can we help with the impact with the community and bring the community back as well. So, and I think it takes, it's all the different players to, get around the table. And I think we've been doing that, including with the hospital association, the local leadership here in our three communities. And it's been good, but I think the conversation has to continue and just, probably for months, but.
Yeah. You bet. Reza, you want to hit this one next?
Yeah, I think we want to be as helpful as possible in the community with all of those things you talked about, Karl. Going back to that metaphor of turning the dial, I guess the concern we have if big employers in town start bringing folks back on or opening their businesses in a way that doesn't exercise discipline, social distancing, and other things, we could end up with another surge or a surge that we haven't seen to this point. That could be a problem for all of us here. So we want to make sure we're partnering well with that. I was on a call yesterday with Dr. Person from the Health District and Dr. Larry Yeka from the Walla Walla Health Department, just talking with them to try to understand a bit about how we could maybe, using our case management team or others, partner with them to clarify or maybe help with some of the contact tracing work and other things that the governor had announced about 1,500 employees that might be put forward to help with contact tracing across the state, but we're not sure exactly what that looks like or where those folks would come from. It's been intimated that maybe it's the National Guard that would do some of that work or others. And the health district certainly doesn't have the level of staffing that they need for a population of 300,000 in the Tri-Cities to be doing all of that work on their own. So we definitely want to partner with the health district and others to make sure that as a community we've got kind of an eye on this and got resources if we have resources that we can help bring to bear on it, because we're all impacted and affected. So absolutely, it'll be a conversation going forward.
Yeah. John, how about Trios? How are you guys working on, planning for the reopening? And
Yeah, certainly all the same things everybody's talked about. Frankly, we've been pretty myopic internally on testing and what it means for us and how we get back to some of the surgeries and other things. But I think, we started just a couple of weeks ago now talking about the community and how we could be a resource for testing, because we do have equipment, we do have facilities, how we would do that. And certainly the Benton Franklin, health department, working with them, we're open to how we work together. I mean, we're a community resource. We want to be part of that solution. Nobody really seems to know how it should roll out. And do you go on site or do you bring people to a different site? I think those are the things that need to be worked on. And then you just have to have availability of the kits to actually pull it off. I mean, these aren't just small thousands, it's a lot of thousands of tests and machines that aren't always used to that volume. We're, certainly not the University of Washington that can, even at theirs, they can run 1,000 tests a day sometimes on certain tests. Well, we can run several tests between the three of us, but it will have to be think through size and scale to be processed. But I think all three of us are wide open to how we can be an equal partner in that and help the community get back to work, because that benefits everybody.
You bet. Well, guys, we're down to 3 minutes. Why don't we just go back around the virtual room, I guess, if that's what we're calling it. And if everybody just wants to, maybe make a closing statement, but I want to kick it off and just say, really, really appreciate all three of your time this morning. I think we've had a good conversation, and hopefully, this is on Facebook Live and then we'll have recordings of it. But I think, this has been a great chance to talk about, what each of you and your facilities and your teams are experiencing and what you're looking for, coming out in the future. And we just really thank you for your time this morning. And maybe Reza, you want to kick off the closing statements?
Yeah, I think the only thing I want to say is thank you to everybody, to the whole community, for all the support and well wishes and prayers. And it's been an interesting time for everybody. And I hope the information today was helpful. And we're here, as we have been for 76 years, to support this community and be here. So just close with a thank you. Appreciate the time today.
All right, thanks, Reza. John, you want to go next?
Yeah, similar. Just thank you for the community for your support and the meals and all the other supplies that they've given us. It's made a difference to what we can do. And then second is a big thank you to the employees that come on the front line every day. I mean, they're showing up for work while their spouses or others are able to work from home. These are people on the line to care for people that are really sick and want the best for them. So I want to thank them. And then thirdly, we'll all work together at 3 hospitals of what we need to do to, make improvements for the community or support the community as they transition back.
That's great. Rob, how about you?
Yeah, I would echo what John and Reza both said. I really thank the community for all the outpouring of support. Thank the frontline people out in the field, the EMS crews, the fire departments, the police departments, the sheriff's departments, public health. Everybody's just playing an amazing role in this whole thing. And then our staff have just been have redefined the definition of hero for me. They really do take on. They've taken us on and take it in stride, and I'm just blessed to work with such a talented group of people. So, but thank you so much for the opportunity today, and the community support has been fabulous.
Okay, well, that's going to bring Coffee with Karl to a close today, but thank you to all 3 of our guests and the conversation. It's been great, and we really appreciate your time. And if you could pass that thank you and support on to all your teams, they really are the heroes. And thank you for your support of the community, and we'll look forward to coming out of this together. Thanks a lot, everybody. Have a good day.
Thank
Thanks.
you.
Cheers.